Hey everybody, I'm Samantha and welcome to our video for today where we're going to unfold some important tips to resolve the most common denial, which is CO97. This is also the most frustrating denial. So Anshuli, could you tell us what does denial CO97 truly mean?
Sure, Samantha. Hi, everyone. So, if we talk about denial CO97, it basically means that service is not covered by the payer or the plan. So, but this doesn't tell you the whole story. The reasons behind may vary. So, sometimes it can be triggered by a coding issue, or sometimes it can be a missing modifier. Sometimes it's just can be an eligibility lapse. So, Samantha, would you please explain an example of these kind of denials to our viewers?
Sure. So let's say if a procedure is bundled under another service but billed separately, that can trigger CO97. Or if a prior authorization wasn't obtained for certain procedures, the claim might also come back as not covered. Um, or in other words, CO59.
Okay. So in this video, let's help our viewers with some important tips and I would say important and easy tips on how they can fix this, or rather, I should say they can prevent this CO97 from happening.
Exactly. Tip number one. Always verify coverage before service. A quick eligibility and benefit check can prevent 30 to 40% of the CO97 denials.
That's a good one. And then I can recall tip number two, which is always double check your coding and your modifiers. So for example, if we use modify 59 correctly, it can clarify that procedure was distinct and it should be covered separately. So tip number two would be double check coding and modifiers.
Certainly. So, another important tip is reviewing payer policies regularly. Some denials happen just because payers update their coverage criteria and the practices aren't even aware.
That's a good point too. I completely agree with you. So yeah, what would be the takeaway from today's discussion, Samantha?
So my takeaway from this discussion today, denials like the CO97 aren't just the rejections, they're feedback. Each one points to a process gap that can be fixed. The goal should be to move from denial management to denial prevention, and that starts with awareness of proactive RCM processes.
Exactly. And even the industry reports show that nearly 60% of claim denials are preventable and 80% are appealable if they are quickly or properly addressed.
I hope this discussion will help practices identify areas where the process improvements can be made. If you'd like expert help identifying your practice's operational gaps and improving efficiency, Staff Go Health offers a free practice analysis that'll get you started.
Perfect. All right. So thanks for watching and follow StaffGo Health for more RCM updates and insights that can help your practices get paid faster and stay financially healthy. Thank you and stay tuned.